Move your patient's clothing down to his or her shorts or swimsuit if you feel it is necessary. As you progress through this skill, you should state everything you are assessing. Specific clinical information not obtainable by visual or physical inspection, for example, blood pressure, will be given to you only when you ask the following demonstration of how you would normally obtain that information in the field. You may assume you have at least 2 partners working with you who are trained at your level. They will correctly perform the verbal treatments you indicate as necessary. I will acknowledge your treatments and may ask you for additional information if clarification is needed. Do you have any questions? Did y'all catch voice treat? Any information not obtained by visual will be given to you after you demonstrate how you would appropriately get that information in the field.
Yeah.
Did y'all hear that I want you to do this as you would in the field? How many times have I told you that? In there doing that assessment.
39 and a half.
Yeah. Pretend you're out in the field when you do this. But you've got to voice treat, voice ask, do the assessment. They're not going to give you anything. Raise your hand if you've asked me if the patient's breathing and I told you I have no idea. Raise your hand. That's what they're going to tell you. They're not out there in that field with you. Y'all get that? Okay? Does that make sense to you?
So we ask for rate, rhythm, and quality?
Rate, rhythm, and quality of everything. Pulse and breathing. Respiratory rate. If you have a bleed, when you put a dressing on it, what do you have to ask them?
Did it stop?
If it stops it. Out in the field, when you put it on, you would know it stopped it because you saw the bleeding stop. In there, you're going to have to ask them.
So,
When you do a head tilt chin lift or a modified jaw thrust, you're going to have to ask them what?
Airway open.
Does that open his airway? In the field, you would know it because you would see chest rise, feel air, and hear air, correct? That's what all that means in there. You've got to talk your way through it and then voice treat and voice find. Does that make sense? You've got to grasp that, folks. You've got to have that understanding.
So everything you do, just say it out loud.
Say it out loud. And they may ask you questions.
How do we talk to the actual patients since they're gonna be live patients?
Yeah, you'll talk to them. Say, hey, you know, in your assessment of AFPU,
Will they respond to us?
they will have been told what to do, depending upon your scenario. Okay? Does that make sense?
Makes sense.
Okay.